New tonight, each night this week we heard from nearby health departments about different key health issues for the 30th anniversary of National Public Health Week. Tonight, our Megan Marshall talked with health administrators about the last key health issue. She joins us now in the studio. Megan.
The 30th anniversary of National Public Health Week is coming to a close in the next few days, but health officials say public health work continues on. In our last part of the National Public Health Week series, we will hear from health officials about the challenges and the efforts to strengthening the public health workforce.
The American Public Health Association has organized National Public Health Week every year since it started up in 1995. The APHA highlights 5 new key health issues each year during National Public Health Week. The 5th and final key health issue is strengthening the public health workforce, a goal that takes identifying future challenges and addressing them, according to Susan Polan, who is the Public Affairs and Advocacy Assistant Executive Director for the APHA.
Over the last 30 years to look back and to think about all of the advances we've made and all the challenges that we've addressed and how we have made it to the place we are. And now let's look to the future, the next 30 years. What are going to be the most immediate needs for public health? What are going to be the most immediate health issues that the public needs to be concerned about? And what role does public health play in the improvement of people's lives moving forward?
Courtney Midcalf, the Meigs County Health Department administrator, says it is a challenge to build the public health field in their area.
Improving workforce development is always a goal. It's become a challenge in this day and age, to find people who want to come into public health, because a lot of people don't know what public health is. They think of doctors and nurses, but the public health field is really a whole system.
The Marietta, Belpre, and Mid-Ohio Valley Health Departments say funding has been one of the reasons it is hard to find public health workers.
There is a huge need for public health workers. It's not a well-paid position, but it's rewarding. It's rewarding. It really is rewarding.
One of the biggest threats for our workforce is the lack of pay and salaries. When you hear that a state employee is getting a pay raise, we're not getting that pay raise. And because of how we are structured funding-wise.
Health departments face workforce challenges, but they agree the best way to combat it is through partnering with schools and encouraging people to volunteer with them. Jack Pepper, the Athens County Health Department administrator, says it is strengthening the public health workforce through a partnership with Ohio University.
So we do engage with Ohio University often in trying to make sure that students are aware, of opportunity in public health. Really important that as working professionals that we are taking the necessary steps to make sure that that the next generation of potential employees is aware of the work that we do and how they can get involved.
He says they work with younger generations throughout the year as well.
We certainly are advocating at both the elementary, middle school, and high school levels here in Athens County. That really is the most fun kind of work that we do, when we get to interact and engage with kids, and then at the same time maybe spark an interest, a longer term interest into like, hey, this is something that I think I could see myself doing.
Reporting from Parkersburg, this is Megan Marshall. WTAP News, this is home.
To read more about how these health departments are strengthening the public health workforce, head over to WTAP.com. Back to you.